Okay, I guess we can get started. It is now 12 o'clock. I would like to welcome you all. I am Dr. Halima Leek Francis, the director of the Public Administration program in the Tulane School of Professional Advancement. And today I'm here to share with you some insights on philanthropy and civic crisis. Given what we are seeing today, the philanthropic sector has been hard at work responding to the needs of our communities, and it is really great to see some of the things that are happening locally and nationally. So I'll be sharing some perspective and insight with you. Now, prior to coming to Tulane, I worked in the nonprofit sector for about 20 years. Much of my work focused on organizational capacity building and sustainability. And during that time, I have also been involved in a host of strategic philanthropic projects and initiatives that have been designed to strengthen nonprofits as they do their work within their communities. So this is a topic and an issue that I care deeply about, and I'm really happy to have the opportunity to share some insight with you today. Now, in my role at Tulane, I'm responsible for the development and leadership of academic programs that are related to fields tied to public administration. And this includes the launch of our new online MPA program, as well as graduate certificates that we carry in topics like economic development, environmental management and resilience, K through 12 educational leadership, and nonprofit and strategic philanthropy management. So I'd be happy to talk to you more about that later on. And if you would like to learn more about our program, feel free to visit us online at sopa.tulane.edu/MPA, or you can attend our upcoming webinar on the program that'll take place on May the 5th. And I believe there'll be some information posted on that as well on Facebook Live. So before I kind of jump into my thoughts in our conversation, I first want to thank our healthcare workers, our essential personnel, people who are helping us with food, essential basic needs, first responders, our nonprofits, and our philanthropic organizations. The work you are doing is amazing and tremendous, and you are keeping us going. We couldn't get through this without you. So like many industries, what we're seeing today has changed. It has utterly transformed how we approach our work, and philanthropy is uh, is very similar to other industries and other fields that we're seeing. We are really having to rethink our approach to charitable giving, rethink our approaches to getting resources out into the community. And likewise, our nonprofit organizations are having to rethink their approach to work. Alongside with addressing immediate needs, we've had to grapple with issues that will arise, or midterm and rebuilding and long-term resilience, making sure that our communities are safe and sound and whole. So in talking about the trends that we're seeing in philanthropy, I'm going to focus mostly on our community-based foundations and organizations that largely operate on public support through individual donations, donor advised funds, giving circles, and other contributions that they receive. So why is this important? Why is it important to talk about the philanthropic response to civic crisis? Oftentimes, philanthropy is described as this kind of third sector outside of government and private business. It operates a little bit differently, sometimes to fill some gaps, funding resources, address problems, develop solutions alongside government and business, and it operates in ways that other sectors don't necessarily operate. Also, I think I'm having a lag here. There are a lot of resources that are moved through philanthropy, or mobilized through philanthropy. The Giving USA 2019 annual report on philanthropy that focused on the year 2018 reported that over $427 billion was donated in the United States in charitable contributions. So as you can see, there are a lot of resources that are distributed and mobilized through the practice of philanthropy. And in the midst of what we're seeing today, literally millions of dollars are being moved weekly and in some cases daily in response to the COVID-19 crisis. So the philanthropic space has had a tremendous impact and continues to make a tremendous impact as we seek to recover, as we seek to keep our communities and our families safe, as we seek to make sure that we have the resources that we need to continue to survive as a community and as a society. Now, I do want to say, just as a bit of a caveat, be careful in your charitable giving. All of us want to help, all of us want to contribute. And in this conversation, of course, comes the topic of individual giving. What can I do to contribute? Unfortunately, there have been some circumstances where people have taken advantage of the situation and made faulty claims of help. So I want you to be careful in your own charitable giving as you're thinking about this topic and as you're thinking about ways that you can help address the issues that we see today. Now, in looking at some of the crisis trends and shifts that we're seeing in the practice specifically of charitable giving for foundations in particular, there are some key giving priorities that have emerged, and this probably is not a surprise to you. Some of those priorities are things like access to healthcare services, food insecurity, access to alternative sources of income for people who have lost employment, have lost jobs. So making sure that people have those basic needs. Also support for essential workers and medical workers, first responders. There's also a great deal of funding that is being directed towards medical research. So those are things that are not necessarily surprising, but it's interesting to see compared to trends that we may see in previous years or in other years where we don't necessarily see this crisis of such a magnitude. So that has a huge impact on the practice of philanthropy itself. Now, a lot of giving has been focused on disaster response, disaster recovery. So what does that mean for organizations that need to continue to provide the service? It's important to make sure that there aren't any service gaps because we're vulnerable to that, because a lot of the fund is being diverted or moved to address immediate crisis needs. An example of a project that has been focused on immediate crisis needs is the recently launched or recently announced Louisiana Service and Hospitality Family Assistance Program that's out of our own Greater New Orleans Foundation. That program is really working to make sure that families who work in the service and hospitality industries, industries that are some of the hardest hit by this crisis, have resources, have what they need, and are able to survive through this crisis. So some of those areas have been highlighted there. Another trend and shift that we're seeing is changes in our responsiveness and approaches that we see in the philanthropic community or in charitable giving. A lot of foundations are collaborating more. They are thinking about ways that they can work intentionally together. They are developing strategies where they are pooling their resources. They are developing resource guides for organizations and individuals. So they have really worked to collaborate effectively as they address this issue. Another trend that we're seeing in terms of responsiveness and changes in approaches is the acceleration. So typically within the foundation world, grant making, decision making may take some time because there's a heavy evaluative process that goes along with that. They want to make sure that they're doing their due diligence and making funding decisions. Well, now the times call for urgent action. The times call for decisions to be made in a shortened timeline where typically it may have been, or in the past, it may have been a 3-month timeline before an organization or a nonprofit hears back from a proposal that they submitted. Now, the turnaround can be in as little as a day or a couple of weeks or even a week. So the focus has been on accelerating the work that they do to address urgent need. Again, making sure that service gaps are not seen and that there's no major or additional major disruption in the giving that takes place. Another shift or another change that we are seeing in some of the trends in response to this crisis are changes in practice and process. A lot of that is around removing barriers. So removing barriers for nonprofit organizations and individuals to get the resources that they need. Processes have been streamlined, restrictions loosened. Oftentimes within the grant making world, there's a tendency to fund projects or specific programs. Funds are now being changed where the funding is unrestricted. So there's this trust that philanthropic and foundation organizations are putting in the nonprofits that they are supporting to get the funds out, to get the resources out to the communities that they serve. So the restrictions, many restrictions are being lifted, and the focus is on making sure that these organizations, that nonprofit organizations, are well positioned and well equipped to meet the needs of the communities that they serve. Now, some examples of this, I was participating in a call, or I saw a call that was hosted by Dallas Social Venture Partners, where several of the foundation partners or foundations within the local community had joined together and developed a common grant application. So to remove that barrier of nonprofits having to complete multiple applications. There was a recent article in the Chronicle of Philanthropy that talked about 6 steps for grant makers to take now to ensure nonprofits recover from the coronavirus spread. And it talked about some of the recommendations that they made were to make funds unrestricted, to pay full costs, because oftentimes when funding is received, or traditionally when funding is received, it is not a full cost funding. So it funds a portion of the programming cost. Also, remove or delay reporting requirements. That's another grant management issue that has that some organizations or some foundations are considering removing in light of what we're seeing, because the management, the recording, the reporting, the site visits, monitoring, and evaluation, that's another level of work that organizations have to do, that nonprofits have to do, and it sometimes can pull away from them being able to directly serve the communities. So as we think about what's next, so thinking about how is this crisis going to change permanently what we see, or how could it change permanently what we see in the philanthropic sector? How can it change what we are seeing from our foundations? I think that there's a few things. So one, continuing to think about how we work together. This experience has highlighted for many foundations and many people in the nonprofit world the importance of collaboration, the importance of really truly having good partnerships that foster or that facilitate great work. So making sure that your relationships, your partnerships are meaningful, making sure that they not only are positioned to address immediate needs, but also those mid and long-term needs. So some of the things that may be considered may be reshaping grant programs so that instead of funding for 3 to 5 years, there's more of a consideration for a long-term funding relationship. Being more resilience-minded. So thinking about not only, again, addressing urgent needs, but how do we recover and learn and progress from this? So how do we safeguard our communities from dealing with some of the long-standing challenges that have made some communities more vulnerable than others in dealing with this crisis? Also, rethinking our responsiveness and planning. So this has really highlighted for a lot of foundations, and I've heard from many colleagues in the field that rethinking how they respond to their grantees. So how do they respond to the needs of their grantees? So there's this balance of responsiveness to what's actually going on, what we're seeing in the communities, what we're seeing as needs and opportunities, but also balancing that with strategy, because oftentimes a lot of the focus may have been on one or the other at any given time. So rethinking how we respond and how we plan work that's done within the philanthropic sector. And then lastly, another area will be rethinking our strategies. So looking at programming versus funding sustainability, funding immediate outcomes versus long-term outcomes, funding systems changes or addressing issues that we see kind of systemically within our communities is another area in terms of funding strategy to think about. Helping organizations to build capacity is another area that's been something that has been talked about throughout the sector, but I do think it will be kind of lifted as more of a focus in the years and months to come as we kind of reflect on what we've seen. So either way, the crisis that we face today shows us firsthand the importance of charitable giving and philanthropy at every level. I often talk about charitable giving as being a means by which we can not only address the challenges and problems that we see within our communities, but we can reshape or we can shape what we hope to see in the future. Philanthropy has played a key role in establishing many of our civics anchors, schools, hospitals, universities. Philanthropy has been there as long as this country has been here. So being involved, being engaged in the practice of philanthropy is critically important as we seek to develop and build communities that are safe, that are thriving, that are healthy, and that are whole. So I want to thank you. Thank you for joining for this talk. I know it's been kind of brief. There are some questions, and I do open the floor for questions now, and I'm happy to answer them. I see one has come through about the MPA program. So when does the MPA program start, and is the application open? The program starts fall 2020, so we will be starting our first cohort fall 2020. The application is open. It opened in December. So if you are interested in being a part of that fall 2020 cohort, the first class of this MPA, I encourage you to get your application in as soon as possible. We are evaluating applications and reviewing applications, and I'm happy to review yours as well. So thank you. Are there other questions? Are there other questions? No more questions. Okay. So with that, I thank you for joining. Thank you again to all of those who have made the sacrifices of serving our communities throughout this crisis. Thank you to our philanthropic community, our foundations, for the adjustments you have made, for the decisions that you have made in being diligent in getting resources out to the people who need them the most. And I encourage you, as we continue to work through this crisis, take care of yourself, take care of your families, be safe, seek out the resources that you need, and stay encouraged. We will get through this, and we'll get through it together. Thank you so much.